My name is Corinne Wilkinson, and I have chosen to talk about self-harm. Before I start getting into my slides, I would like to talk a little bit about recovery, because I feel that recovery in the whole process is a reality for all, and it is about the right support, and it's about connections, hope, identity, meaning, purpose, and empowerment. And as counsellors, we are their partners. We are partners. We're not fixers, and it's about living well and not being simply treated. So this presentation explores how self-harm presents risks within counselling practice. I will outline relevant indicators, contributing factors, and effective responses aligned with the AIPC ethical and practice frameworks. As counsellors, we have a duty of care to first assess, plan, and then respond. This means responding appropriately to self-harm risk, whilst prioritising the client's safety, autonomy, and well-being through ethical, evidence-based strategies and collaborative planning. Understanding self-harm. Self-harm involves intentionally injuring oneself without intending to end one's life. It can include cutting, burning, or other forms of self-injury. This is usually a way to cope with emotional distress. Counsellors need to understand that self-harm is often a means of regulating emotions, in a sense, numbing the pain. It signals psychological pain, not necessarily a wish to end their life, but an urgent cry for support, understanding, within a therapeutic and ethically responsible setting. Relevance to counselling practice. Self-harm is a critical concern in counselling as it poses physical and psychological risk to clients. It can signal underlying mental health conditions, unresolved trauma, or emotional distress and upset. Within the AIPC framework, counsellors have a duty to uphold professional standards, ethical considerations, awareness, and sensitivity. Recognising and identifying self-harm enables early interventions and referrals, prioritising their safety and well-being as the top priority while maintaining a supportive and non-judgmental, person-centred approach in the relationship. Risk to clients. Clients who self-harm face risks such as permanent injury, accidental death, and escalating suicidal thoughts. Psychologically, they may experience feelings of guilt, shame, and isolation. Without specialist support, these risks can increase. Counsellors must assess both immediate physical danger and underlying emotional drivers. The AIPC framework guides practitioners to balance safety and empathy and autonomy, recognising that controlling behaviour without understanding it can only heighten distress. Key risk factors. Common risk factors include a history of past trauma, abuse, mental illness, especially depression and borderline personality disorder, substance abuse, social isolation, and low self-esteem. Environmental stresses such as family conflict, bullying, or academic pressures may all contribute. A counsellor must be attuned to developmental, cultural, environmental, and momentary determinants when evaluating self-harm risk. Awareness enables early recognition and collaborative support through risk assessment and collaborative personal safety planning. Indicator for counsellors. Indicators may include unexplained injury, wearing long sleeves in warmer weather, withdrawal, emotional numbness, or continual crisis alerts or statements. The client may disclose feeling out of control or numb. Counsellors should notice behavioural patterns, mood changes, and especially non-verbal cues. Using sensitive, open-ended questions can help explore potential self-harm safely, making sure the client feels heard, seen, and not judged. Early recognition is critical to effective interventions. Assessment and planning. Risk assessment should be ongoing and collaborative. Counsellors identify methods, frequency, intent, and triggers of self-harm. Using AIPC ethical guidelines, therapists assess immediate danger, use supervision as a sounding board, and guide clients appropriately and document all findings clearly. It didn't happen if it's not documented. Planning involves creating a structured safety plan collaboratively with the client, written by them, identifying coping strategies, supports, and steps to reduce harm. Clear, open communication and informed consent remains essential throughout. Safety and intervention. A safety plan may include identifying safe contacts, coping strategies, journaling, or reaching out for support during distress. Confidentiality is maintained unless the risk is proven to be both imminent and high. Counsellors follow ethical guidelines to ensure duty of care, balancing trust with recovery actions to prevent harm while fostering hope and empowerment. Referral and collaboration. Referral may be necessary when the client's risks exceed the counsellor's scope of competence. Collaboration with GPs, psychologists, or crisis services ensures integrated care. The AIPC framework supports a team-based approach, ensuring clients received appropriate clinical, medical, or crisis support. It is essential not to fall into a deficit mindset and to explore a recovery-orientated approach. Recovery is a reality for all. It's about what you can do, not what you can't. Ethical and reflective practice. Self-harm requires counsellors to reflect on their own biases and responses. Supervision and ongoing professional development and support are crucial for ethical practice decision-making. The AIPC framework emphasises person-centred care, respect, confidentiality, and cultural sensitivity. Reflective practice helps counsellors manage emotional impact, be aware of and maintain boundaries, improve competence, and ensure clients experiencing self-harm receive compassionate, ethical, and effective support.